chiropractic adjustments, like I said, this is not in order of importance. But keeping the nerve system free from interference is going to be really, really important to our overall health, because our bodies can't do what they need to do, and we're going to go into why, if we have misalignments in our spine. And we're going to go into the chiropractic part now, but when you look at, and then people are like, oh, okay, we're finally going to talk about my back. This is really important to understand, and this is why we go over all these things. If I could adjust you every single day, but if your diet is terrible, okay, you never exercise, you get no sleep, you are emotionally stressed to the max, you know, you don't drink any water, obviously there's only going to be so far that you can go, and the changes that are made are not going to be ideal, okay? We get better a lot quicker when we're taking care of ourselves as a whole, okay? And, you know, same thing and vice versa. You know, you take any one of these things. You have people, again, who eat well and exercise and all these things, but let's say they've got misalignments in their spine that they've never dealt with. They're never going to be at their best, okay? So, when we look at, this is the spine, okay? When we look at the spine, you've got the vertebrae all the way down here. In between, running down the back of in our spine is the spinal cord, and at each level, you're going to have the spinal nerves that branch out, okay? And they go to everything in your body, okay? So that's how the brain controls the entire body, is through the spinal cords and the spinal nerves. All right, so depending on where we are in the body, you have different nerves coming out. So I always use a great example, which is pretty easy for most people to understand, of why, this is why chiropractic can have effects on other systems of the body, not just our neck and back, okay? If, let's say, someone's having a problem in the area where the nerves come out that go to the stomach, you know, let's say after a little period of care, it'll say, you know, I used to have heartburn every day, and that's not really happening anymore. You know, is it like voodoo, or did the chiropractic help with that? Well, chiropractic may have helped with that if those nerves were being affected by a misalignment, okay, in your spine was affecting those nerves, then yeah, as you get that misalignment taken care of, that may improve. However, that doesn't mean that chiropractic is a cure or a treatment for, you know, heartburn. Because the next guy who comes in, you know, people get really psyched about it. They're like, oh yeah, my chiropractor helped my heartburn, my hangnails, you know, my ear infection, like all these things. Well, if the next guy comes in, he's got ulcers in his stomach and his diet is horrendous, you know, even if he has a problem in his spine, that area, no amount of me adjusting his spine is ever going to change, you know, that heartburn. So you have to just look at different things. But that's why oftentimes people notice other things improving. So on the top, you've got what a normal, all right, you've got two vertebrae, the disc in between, the spinal cord down the back, and then the spinal nerves coming off, all right? Then here you've got one that is diseased, okay, and you can see that that's affecting the nerve. So whatever's on the other end of this line is not going to be at its best, okay? Doesn't mean it's going to die or fall off or not work at all. Just means that it's not going to, those messages are not going to be as crisp, clear, and as efficient as they should be, okay? So and this can happen two ways. One is if things are out of alignment, okay? The other is sometimes things are perfectly aligned, but they're stuck and they're not moving properly, or they may move too much. All right, any of those things we call a subluxation, okay? It's a big long word, but that's what it means. It's either an improper motion or misalignment in the spine, and that's what we're looking to work on. Now this is kind of big picture philosophy stuff, but regardless of what type of doctor you go to, doctors don't heal or cure anything, okay? Your body does that. And a lot of times it's just not something that we think about, but whether you're here or you go to the cardiologist, the urologist, a lot of people think that, and even if you get down to whether it's an adjustment or a pill that you take, those things don't cure you of anything, okay? They may give you a nudge in the right direction, okay? Like an antibiotic will knock out, if you've got bacterial infection, that will knock out the bacteria, but your body still has to then, okay, now the bacteria's gotten rid of, you still have to do the repair part yourself, okay? That's where our bodies shine. Again, a Band-Aid does not heal anything, although I will give this to Band-Aids. They keep the dirt out so it doesn't cuts don't get infected while your body heals itself. From the inside out, that's really, really important, as long as there's no interference, okay? And that's why we want to make sure that our bodies are working at their best, okay? And that's why chiropractic is a lot more than back pain, okay? Because if anywhere in our spine, and that's why a lot of times we look to the whole spine. Just because someone says, my back hurts, we don't just say, oh, okay, yeah, right there, that's the button. All right, you want to make sure you look at the person as a whole and make sure that everything else is working properly. Because as we discussed before, some people, we've had people who come in that they just want to get, they feel fine. They want to just get maintenance adjustments. Then we take a look at them and go, oh my, they've got a complete reversal in their neck. It's just a matter of time before that becomes a major problem. We want to make sure that we're taking a look at all those things and make sure that your body is working the best that it can in general. Okay. So who needs chiropractic care? This is not our daughter. This is our niece who, now our daughter Amelia, she's been adjusted since a couple hours after birth. Okay. Kayla was adjusted the day after she was born. Well, I'll tell you our story first. I really do think that anyone with a spine not necessarily needs to be adjusted, but needs to be checked. Because again, a lot of times we don't know if we have a problem until it becomes too late, until we have symptoms. But infants to elderly really can get adjusted. And obviously I adjust a couple-hour-old baby very differently than I adjust a 26-year-old linebacker, very differently than I adjust a 99-year-old severely osteoporotic woman. All right, there's many ways to adjust people. Okay, when I'm adjusting a baby, it's a vibrating finger. That's it. Most of them sleep right through it, and parents say, "Did you do anything?" And it's very, very gentle. Okay, same thing. We can adjust with our hands. We have instruments that we can use to adjust. We have wedges and blocks that we can use to kind of allow the body to adjust itself almost when they're properly positioned. There's so many ways to adjust people, and that's why anyone can get adjusted. But I really, truly feel that infants to elderly should have the opportunity to express their vital life force to the fullest. Because if we're living with subluxations, misalignments in our spine, we're not living to our fullest, okay? And Kayla, she was about, I think 2 months old or so, when she had 2 separate times she had bouts of constipation, and she had not gone to the bathroom for 4 or 5 days at a time, and I just happened to be with my family, and so I checked her, and as I was, she had a misalignment in her spine. As I was adjusting her, both times, she had immediately resolved the problem. Yeah. That's the thing about kids. That's why I love adjusting kids. And we have a whole tree of life over there with, we've started to put up the pictures of the kids that get adjusted. When you're dealing with kids, because problems haven't been there for 40 years when they come in, a lot of times kids heal a lot faster. Okay, they respond quicker because everything's about their metabolism's faster. So it's kind of cool. You get that instant gratification, which, yeah, in that case was kind of fun. But like I said, a lot of people don't come to us until they have a problem, and it's actually a lot easier to keep people feeling well, all right, and deal with the things before they come in like this and say, this just happened yesterday, and I go, gosh, I wish you'd seen me 10 years ago. Because that, unfortunately, that's a lot of times what ends up happening. So if you know of anybody, feel free to pass that coupon on. Then we'd be more than happy to see them, or at least sit down and talk, because there's a lot of people who don't know what we do, or who don't know if we can help. And a lot of times it just helps to sit down and say, like, can you even help me? And a lot of times we can, not always. And if not, a lot of times we'll refer people out to someplace else that can help them better.